So whether you have an injury or you have chronic pain, such as a back injury, arthritis, or all the myriad of reasons why you could have chronic pain, I want to help you to have quality of life. So when you have chronic pain, the first thing that happens is that sense of self, that loss of who am I going to be? What am I going to be able to do? What am I going to be able to enjoy? A lot of pain comes with depression, anxiety, stress. Heck, just managing going to the doctor, taking the pills, figuring out what can I do, what can't I do? How can I still be an active person in my relationships, in cleaning the house, in doing basically anything? So that whole sense of self is thrown out the window, and we want to regain that. You don't need to stop being who you are. You just need to integrate this new aspect of you into your life. So understanding the pain is one step, and understanding who you are with the pain is one step. As well as, of course, you work with your doctors for the physical pain. Though I want to help you with some of the things that people don't think of when they think of pain management. Think of how your emotions play a role in how you respond to everybody. Are you going out there being cranky? Are you moody? Or are you even faking it and pretending to be happy, pretending to be joyful, and inside you're miserable and you're not enjoying life? Having chronic pain can really just put a shadow on your whole life so that it's just not as good. Food doesn't taste as good, and going out and doing things isn't quite as much fun. Also, learning to balance things so you can go out and have fun. Your definition of fun may change a little bit. You might be able to do one thing, such as go out to dinner with friends, but after sitting for so long or standing for so long, you can't then follow that up with going out to do something else afterwards. You may only have so many good hours a day, and using those good hours, managing your life with chronic pain, that's a really important skill to learn. And I want to help you understand your pain so that we can make these adjustments in life. Also, dealing with your loved ones. They don't understand. Learning how to talk to your loved ones and explain what your pain is in a clear way, a way that not only you understand, but they understand. Being able to voice your concerns and not just say, oh yeah, it's another bad day. Well, what does that mean? What do they take that as? And after hearing that a few times, do they even listen? So being able to talk to your loved ones is important for you to have a good quality of life. And then the last part, the part that people really don't consider with pain management and counseling, why would you come and talk to somebody for your pain? Well, it's not just talking. It's not just about depression. It's also about actually turning off that signal. Your brain sends a signal to your body, and your body then responds back. Well, if your body is responding back saying, ow, this hurts, we need to learn how to turn that fire alarm off. We need to learn how to dampen that so that you can push that aside and be able to function better. Now, can you do this all the time every day? Probably not, though it's going to increase your functionality, as well as not just turning off the pain signal, but getting rid of other things that make your pain worse, dealing with that extra anxiety, dealing with the poor sleep, dealing with many aspects of life that contribute to chronic pain and just inflame it and make you feel even worse. So from all sorts of different areas and aspects of your life, we want to make everything just a little bit better and make it as much better as we can, make it as good as we can get it, so that you can have the best quality of life. For more information, you can contact me, Dr. Chelsea, on social media or go to www.drchelsea.com, or you may call my office at 480-855-4009. I look forward to helping you with your health concerns.